We talked about anti-inflammatories. What's your recommendation when someone starts that? They obviously work, for that matter, and do you recommend them?
I do. I'm a fan of anti-inflammatories for acute pain. Very important that you first make sure you can take them. If you've ever been told by your primary care physician that you have a condition and you can't take them, avoid them. For acute pain, I like them. I definitely tell all my patients, take your anti-inflammatories with food and take them as directed. If the recommended dose is not helping you, then it's not helping you. It's not time to double up. And for a short duration, I would say probably not longer than 2 weeks. If you've been doing anti-inflammatories for 2 weeks and you're not feeling any better, that's a sign for me that you should be calling your doctor.
You mentioned foods, doctor. Can we just touch upon maybe what foods you recommend in terms of maybe helping with that inflammation?
Absolutely. So when it comes to foods, anti-inflammatory foods, meaning we want fresh, natural foods. We want to avoid processed foods, processed meats, canned foods. I tell my patients, when you go to the grocery store, stick to the perimeter of the grocery store.
That's where you'll find, great idea.
That's where you'll find your fruits, your vegetables. When you go through the aisles, you'll find lots of canned goods, lots of junk. Try to stay away from that stuff.
That's fantastic. I just never realized it. And I'm actually going through the supermarket and go, that's right, dairy, produce,
absolutely,
protein. Fantastic. I like that. How about injections? A lot of people sometimes say, you know, I'm just not crazy about this idea. Should we do it?
When they are indicated, yes, injections have a role. For acute pain, you need to see a physician. There's so many things that you can do prior to an injection, different types of medications, therapy, alternative, sometimes massage works. But injections also have a role. If you've done all the conservative stuff, if you've done your therapy, you've done your medicines, and you're not getting better, there might be an injection that can help you. In my practice, I perform epidural injections. I perform what's called facet blocks. They're not indicated for everybody, and they're individualized for different types of back pain.